Allida is a research professor at GW. That's where she has her PhD. She's really an inspiration. She's an international human rights advocate. And she's an Eleanor Roosevelt scholar. I've heard her speak about Eleanor Roosevelt several times, and I'm always inspired by it. But this is a big day for you and for Judy and so many people that we love and care about today. And we appreciate so much your being here to talk about this issue of women's reproductive rights. And hope you'll kind of share with us your thoughts in terms of where this fits kind of historically.
Okay, great. This is a fundamental decision. It's a decision about human dignity. It's a decision about who controls the very essence of my person. It's not, I mean, we can talk about body all you want, but that to me is like, can you take care of a hangnail? You know, for me, it's about who I am, who my soul is, what values I have, what responsibilities I have, the core of my value as a dignified human person who believes in social justice. And we have got to focus on getting the public to understand that this is not done in a snap. People weigh decisions. And the decision to decide to have an abortion or not is the litmus test. It's the litmus test for what you think about national health care. It's the litmus test of what you think about women going to work. It's the litmus test about what you think a marriage is. It's a litmus test about what kind of parent you will be. Because what we want, or at least if I can assume this, what I want, is I want every child in the United States born into a family that loves that child, is committed to raising that child, is committing to helping that child become an active, caring, non-judgmental citizen of the state of Virginia, who realizes that they're loved and they're empowered and they're smart and their voice counts. And if we're in a state that says there is no room for individuals to make their own decisions, that the government has to come in and tell you what kind of care you can get, what kind of care you can't get, who can treat your child and who can't treat your child, how you can parent and how you cannot parent, that to me is an abomination. It is the fundamental un-American value. And it is a major violation of human rights. Because the whole concept of the human rights movement, especially since we passed the big dynamic of the Cold War, is that it's no longer about political and civil rights. It's about what you need to fulfill your dreams, to make, to risk yourself, to build a future that you envision, a community that you want to live in, and a government that you respect. And the decision to when and where to bear a child is the bedrock of that. It intersects, what FDR would call the four freedoms. It intersects freedom of religion. It intersects freedom from fear. It intersects freedom of speech. And God knows it intersects freedom from want. And so what we have to figure out how to do, those of us who absolutely believe that a person has a fundamental right to decide when and where and if to give birth, we have to somehow show the state how crucial a value this is and not let it just focus on abortion. Because abortion is key, but it's key not just because of the health and reproductive issues that are involved. It's key because it's about the worth of the person. Well, the Virginia laws altogether are a primal invasion of not only my body, but who I am as a person. It is an assault. And so we've got to figure out how to frame that debate to move people who are uncertain to see the larger ramifications. You know, because it is part of, then it's going to be the birth control pill. You know, it's going to be, Virginia's going to figure out a way to do the morning after pill. They're going to chip away and chip away and chip away until the only reproductive procedure that's available is Viagra. I'm not joking. I am not joking. You know, I mean, look at who this legislature is. And so what we've got to figure out is how not only to let people see how absolutely primal this issue is, not only to women's health, but to men's health, to the fate of the American family, to what health care is in general in the United States. That's one thing. And the second thing we have to do is we have to do it in a year where everybody is burned out and exhausted. And they are so tired of election fatigue. Because what you've got to say is, this is my community, this is my state, this is my country, I'm a citizen, I love it, nobody questioned my patriotism, nobody questioned my love of family, nobody questioned my faith. I am a strong, dignified, compassionate, determined person who believes in equal justice. And if you were going to do restrictive, punitive assaults, which is what we're talking about here, which is what we're talking about with many of the legislators and some of the candidates on the ticket, we've got to figure out how to stand up to that in a way that's not on my watch, that doesn't go down into the gutter, that says, I'm effective, I'm shrewd, I love myself, I love my family, and you cannot knock me down. Because if we don't do it, we're toast. And so I applaud you for your courage in running. I am so grateful in this highly competitive era of money begging that you have put your money where your mouth is and that you have made your money stand with NARAL. And I just want you to know that I'm proud of all of you and that it's a really good fight. And it's a fight we have to have. And it's a fight we have no choice about but winning. So thank you very much.